I think Dr. Dhami will be speaking on that. Dr. Dhami, please.
Good morning. At the onset, thank you, Dr. Vinod, for putting such a simple talk and with an excellent title of War of Flaps. Wherever there's a war, there's a thought, there's a process, and retrospective thinking, what to do, and are we industry driven, are we patient cooperation, and what do we want? We want the best. And you heard that Lasik, what is called as microkeratome Lasik, is not gone. It is still there. It is going to be there. And there are situations where this is the only thing you can do. And I believe what you should know is what you don't know. Understand the complications of microkeratome and then only see that you can avoid those and microkeratome becomes the best. For me, Femtosecond shifting was a pressure, a safety, but before that I wanted to know what all is there in Femtosecond. So that's what I'm going to share with you. Share with you what is Femtosecond, what are the advantages, and really there are some disadvantages too. Femtosecond was designed to deliver a biomechanically engineered flap, faster procedure, lower energy levels, exceptional flap lift, advanced customization, options, contemporary and ergonomic. Well, this is the theory part. Femtosecond laser emits optical pulses which with a duration to the dominant of femtosecond, and that's what separates the tissue. It's a principle of photo disruption. Laser energy is absorbed by the tissue with the result of plasma formation, and the expansion separates the tissue. But the precision is what we are looking here. Well, why all this research was done? Because we were getting larger treatable stromal bed area, enables creation of small flaps, smaller diameters, customized flaps, move the hinge wherever you like, allow user a wider hinge, and may increase the flap stability. That's the main factor. Using the best part of the cornea to ablate is the first reason to shift to Femtosecond. Then what is the difference between the flap of a microkeratome and a flap by the FS, femtosecond laser, is the inverted cut. It's like a tin which fixes onto the box of your anything, tin fixes, but if you invert it, it doesn't come out. That is the how fixation is much better in femtosecond Lasik. It provides a better wound healing, significantly stronger flap adhesions, virtually effortless flap positioning, and reduces flap gutter complications. The biomechanical strength of the femtosecond flap is better because the way it is cut, the way it is separated. I just want to show this portion of it. See how strongly it will fix, like a tin cap fixes into the tin. That's the major advantage of a femtosecond flap. So what we discussed was an inverted bevel cut, an elliptical flap. You can repeat it, tighter spot separations, and OBL incidence is quite less OBLs observed with advanced femtosecond lasers. And the greatest advantage is it matches the anatomical elliptical shape of the cornea, moves the hinge peripherally. Wherever you want, you can put a hinge, whether horizontal or vertical, to save the tissue and ablation going beyond the area of the flap. Just to show you a small video. That's a superior hinge. Superior hinges are always preferred, whereas in a microkeratome you cannot have this because you have only one choice. And then whenever you have a different astigmatic stage, you can create you can change this hinge site, thereby taking it on the nasal side and creating a larger area wherever you want to treat the astigmatism. So, a better flap thickness predictability, you can change the thickness of the flap, whereas with microkeratome, even with a nitro 90 micron labeled marked blade will not give you a 90 micron definite flap thickness. The flap thickness can vary in that from 110 to 120. What in femtosecond flap, it is definitely within 10 microns change. The visual acuity is better. The variation of IOP during creating a flap in a microkeratome is much more. There are expected to be lesser dry eyes. The visual rehabilitation is fast. Now, before you learn a procedure, you should learn what complications you're going to face and what problems are really going to be created. That's where I started. It is better to know what you don't know, and the most important factor in this is docking. A good docking, it influences the treatment, patient counseling, patient and laser handling, patient treatment planning, well-trained surgeon before you commit to surgery, good sterilization and surgeon skills. The steps in femtosecond involve a topical anesthesia, docking, corneal flap creations and excimer laser. See, for docking, a small video, it's very important to place the position of the nose, the face of the patient correctly, because you will be avoiding the loss of suction, which is what you fear. That's a little showing of how we really create a flap. The docking is the first step. Achha. That's showing the flap creation. Now, complications, improper setting and calibration, inadequate training, improper device, wrong. Let's look at the complications. Decentered flaps, suction loss, uncut areas, dense opaque bubbles, flap tearing, and anti-chamber bubble. Let's take them one by one. This is femtosecond is not short of complications. You have a decentered flap, causes nervous patient, loose conjunctiva, squeezing of the eyes. You got to counsel the patient, and depends on the stage at which suction loss occurs. You can manage the suction loss. That's a small 1-minute video to show you the suction loss and how we manage it. You have to be careful. If you talk of complication-free surgery, it is impossible, because that's the only thing if you don't do it. But in this, you can replace you can repeat the flap making on the same stage. That's the biggest advantage of femtosecond laser. Opaque bubble layer, it causes a high laser energy, wrong canal placements, big diameters, but it can be avoided by taking care of the energy. Showing you the opaque bubble layer. See, whenever there's a tight fitting of the PI, these bubbles, they do take some time to get absorbed, so you have to wait between flap lifting and doing the excimer. Basically, the causes are fluid in between the interface, multiple Dowling scars on the cornea. I have to go fast, I can skip it. Anterior chamber bubbles, I'll show you the video only. This is what is the worst when a bubble comes into the anterior chamber. Then either you postpone or you take off the tracker because it will not track with the bubble in the anterior chamber. Vertical gas means thin flaps, scarred corneas can have a gas leaking vertically. We look onto the video because of there is a short of time. A normal docking, a good patient, cooperative patient, but suddenly you will see these two bubbles? There's the vertical gas leaking and there's virtually a perforation in the flap. You can continue with the surgery. Postoperative complications are not riddled through a rainbow glare, DLK and epithelial. This is most common because you are ablating a surface which has been separated and dissected. And then one surface you don't touch, that is the undersurface of the flap. DLK common but can be treated. Epithelial ingrowths are because of excessive maleflations. We have to avoid it. And flap stria, the most annoying and dissatisfying last complication where there are stria on a thin flap, but these are treatable. So the safety is accompanied with complications and careful treatments, and a pre-thought about it is very important. And believe in yourself, whatever you're best with, whether microkeratome or femtosecond laser, go ahead. Thank you. Thank you.
Excellent, Dr. Dhami. You made a... Please be there. Dr. Dhami. So I think Dr. Dhami has made a point. Femtolasic makes the thing much easier. You can customize the treatment. You can customize the flap. You can choose the hinge. You can choose the thickness. You can choose the side angles. That makes the life much easier. And of course, the microkeratome has been very good, but it has certain limitation. I think the biggest indication for microkeratome is if you get corneal opacity there, where the femto can't work well, if you got some other scarring or irregular cornea, microkeratome is a better option, these things. Second, microkeratome is the cheaper option. Third, it's little less painful. Because we are using energy in the femto,